The roadside sign pointing the way to the Bassano Hospital tilts precariously. Built 50 years ago, Bassano General is one of Alberta's oldest hospitals.
The building is a multi-purpose building. This whole left side is long-term care. And then there's
with only 4 active care beds and only 1 doctor in town, this hospital is a multi-purpose building with extended care, physiotherapy, a health clinic, the list goes on.
We're working in a time of scarce resources, and we're trying to do all we can.
So I had the operation done in Medicine Hat, but it's just fantastic to have this facility here. So as you see, they're pretty
78-year-old Audrey Therrien gets physiotherapy after having both knees replaced. If it weren't for this clinic, he'd face 3 half-hour trips to Brooks every week.
Well, yes, I guess it's very important for Bassano to keep this facility here. Really, it would be very sad to lose this place.
George Armstrong's father helped get the hospital built back in the 50s. The area rancher is now lobbying the provincial government to build a new hospital.
I personally feel we need to go after hospitals for the survival of our community. That's really what it comes down to for me. This is a survival issue.
But the future of small rural hospitals is under review. One idea the health minister is considering would see small hospitals converted into clinics or seniors' care centers. A recent audit targeted all hospitals with less than 20 acute care beds. Bassano has 4.
I feel that it is in the crosshairs for sure. Healthcare the costs are spiraling and they don't know what to do about it, and the easy thing is to close facilities, you know.
For George Armstrong and the 1,400 other residents of Bassano, having a hospital here is more than just a healthcare facility. It brings a sense of community, that the town is somewhat whole.
I would hate to see us lose what we have, but maybe they'll change them to better our community.
Town officials argue a full-service hospital is critical to Bassano's future growth.
That facility, at the very least, can be something to the province as far as healthcare goes.
Down at Carl's Place, an eclectic second-hand store on the main street, the sentiment is much more direct.
No way. We need the hospital.
Well, without it, I think we're dead. It's kind of the heart of our community.
It is nice to have people in the community that come to the emergency room. If they need to be admitted, we can admit them and look after them without having them to send out to another community.
The town's only doctor came here 6 years ago, and he's put down roots in Bassano. But that might change if the hospital is turned into a clinic, as some studies recommend.
I'm a little concerned about it, just because you know, we are a small hospital and they are talking about looking at different options.
Dr. Richard says closing the hospital would force some people to leave Bassano.
If the hospital were to close, you'd lose 7 or 8 of our RNs, and those people are, well entrenched in the community with, coaching teams and being involved in community things.
Health Minister Ron Leipert says there are no plans to close rural hospitals, but clearly the services offered in many will change. In his words, to provide, quote, the appropriate level of health care for the community. That leaves a cloud of uncertainty hanging over the heads of those working in Alberta's small hospitals.
Our goal here is to continue to provide excellent care, so that's our goal here. And some days that's quite a challenge, depending on what resources we're doing without. For staff.
In Bassano, Rick Donkers, CalgaryHerald.com.
This compared to the big city.